My name is Andrew Clark, and I direct the Institute for Municipal and Regional Policy at Central Connecticut State University. This is the fourth in our series for our virtual reentry reform month. It was going to be a day on April 15th, and then the COVID pandemic hit, and we went virtual. We've had three in the series so far. The first, we had special guest Mike Lawler, the former Undersecretary for Criminal Justice Policy and Planning, and Lisa Puglisi, Dr. Lisa Puglisi, who's from Yale, who's joining us again today. We talked about the public health crisis in this and how it impacts reentry. We talked about decarceration strategies. And the second one, we're joined by Sarah Russell from Quinnipiac Law, and we talked about national trends during COVID within prisons and how that affected reentry. We also had Carlos Sosa Lombardo from New Haven and Earl Bloodworth, who's with us today, talking about how reentry impacts municipalities and their role as reentry directors for their cities. And the third of the series, we were joined by Jacqueline Robb Thomas, a reporter from the Connecticut Mirror, as well as Dr. Puglisi and others, as we discussed racial and ethnic disparities in the public health system, as well as the criminal justice system, and how those intersect and how they impact reentry. This is sponsored by the Connecticut Reentry Collaborative, and we've done now, this would be our third reentry reform day or series over the past 3 years. And last year, we, as part of the segment when we were actually at the legislature, we focused the morning session on the experiences of the former administration, that was Governor Malloy, and with Commissioner Semple, who we're so excited is joining us today, as well as Mike Lawler, and their trip to Germany in understanding systems outside of the U.S. And how they do things, and more importantly, how successful they are, because they have lower prison rates and they also have better recidivism rates. So people are more successful when they leave, which is ultimately the goal of reentry. And so we showed a 60-minute clip. We had Warden Scott Urfey, who was warden at Cheshire and oversaw the True unit there, which Commissioner Semple will talk about later. And so it was a real opportunity, as those of us who have been working on reentry for a number of years now, we understand that traditionally in the U.S., we look across the U.S. and say, hey, what system is doing things better than us? Because we want to be always doing things better. It took us a while, but we started to realize that the bar is really low in the U.S., that there aren't too many places that have better than 50% success rates for people leaving their prisons. And so when you go and look overseas, it turns out that they, again, have lower incarceration rates, but also greater success rates with people returning. So today we're going to focus on that. We're going to focus on a system in particular in Norway, and their concept of creating good neighbors. And we are going to be joined by Ellen Shee, a first officer from the Norwegian Correctional Service in the Eidsberg prison. And more on her later, but first we will go to a video segment to give you a little bit of a background. It runs about 6 minutes, I believe, on the Norwegian system. So we have a little background before we begin the discussion. So Josh, if you would, and we can play that clip. And again, I'll ask each of the panelists to mute their mic.
Tell us how you got here. I was actually on vacation and we were sailing. And we started partying, and I woke up 1 week later and I was charged with armed robbery and some other stuff.
Markus Coulson is one of 4,000 prison inmates in Norway. That's about equivalent to the size of just the female jail population in England and Wales. He's on a drug treatment course inside the country's model prison. This recovery program is expensive.
Do you mind?
You just need to look around the living quarters to see that.
Are you good on the guitar?
George McBride, from a UK think tank, wants to know if it's worth it. Norway justifies the expense with the belief it's not about being soft, but about being pragmatic. Behind me is what's regarded as the world's most humane maximum security prison. Not a single coil of razor wire in sight, and yet no prisoner has ever tried to escape. Violent incidents are extremely rare. The prison's ethos is simple. Everyone inside will one day be outside and will become somebody else's neighbour. In the maximum security exercise yard, there's a 20-foot Banksy-style image. It's a constant reminder not of breaking bad, but breaking free. Tors Maybe is on his third stretch at Halden to try to break the habit. The former school teacher is 39 and has lived with drugs since the age of 11. It's not easy to give up the life of a dealer which earned him £2,000 a day.
Sometimes it works and sometimes you came out and have a bad day and use drugs again. Like me, so I losing my family. My fiance and kid moves away and I start using drugs again. And it was a short way, so I came here again.
How many children do you have?
I get 4.
4 children.
4 children, 4 different moms, so...
And do they know that you're in here?
Just 3 of them. One of them not.
There are no angels at Halden. Most are hardened criminals. But there's no violence.
I don't know how to be in a normal society without any drugs, without how to react, how to behave or otherwise.
Prison officers are contracted to motivate the inmate, to play the role of mentor and confidant. The prison's by no means drug-free, but there's no economy in illegal substances. So a research team has come over from the UK to learn how to fix the drug-ravaged, violent jails back home.
I do drugs, but not that much. Right.
Sometimes.
Any drugs or just particular?
Cocaine, I like.
Cocaine?
Yeah.
Well, you can't get that here.
Yeah, if you want.
Can you?
Yeah.
You think so?
Yeah. But
Gosh.
you have to order it if you want it.
Gosh.
No one is saying Halden's perfect. The picture postcard setting inside the walls is all part of the rehabilitation theme. You can climb the trees, but you won't get far. The wall and cameras are everywhere. Spending in Halden runs to £76,000 per prisoner per year. That's twice the average in the UK.
When we're talking high security level, you probably save some money for society. If that person don't leave the prison, steals a car, commits a crime, police investigations, time in courts, stuff like that. It's impossible to tally up that amount. I can't say how much it is, but it is an amount. And it's also a saving for society.
Reoffending rates in Norway are at 21%. The UK's average is closer to 55%. But Halden can afford 1 prisoner per cell and 1 officer per prisoner. It's a picture no prison in the UK could even imagine being able to pay for.
It's a society who's chosen to invest the resources in mental health care and helping people get back into society.
Above the fjords sits a former German World War II army barracks. It's now a women's prison and hosts a number of vulnerable victims of domestic and drug abuse. It works on trust. There are no locked doors within the prison, and there's a roll call 4 times a day. Only 1 inmate has ever tried to escape. The drug recovery programs go on inside this chalet. It's the final session for this former school teacher and the prison therapist.
We've spoken about motherhood, what it's like to be a mother, what it's like to be ashamed. We've spoken a lot about shame and guilt, those really, really hard, horrible feelings.
How does it feel to leave, to be leaving?
Well, to be leaving this place is very sad. I'm going to cry because of all the people that work here, but also the women that I'm here with. We're almost like sisters, so that's very strange.
Back at Halden, the prospect of release for any of them is not imminent. But Tor Smeby can at least look forward to a reunion.
Are you nervous?
Yes, I'm very nervous. It's like lots of joy, but I'm very nervous. I have to answer some questions, so.
What will you tell her about being in here?
I have to tell the truth and tell her what I've done and be honest. I think that's the best thing to do.
Do the inmates of Halden's C8 unit offer any solutions to Britain's prisons crisis, where treatment services have been cut by 40% and drugs are a well-established commodity inside? It's difficult to measure this prison's effectiveness, but at least it knows what it's trying to achieve.
The Norwegian prison system, as was mentioned in the video, and we'll hear later, the primary mantra is, who do you want as your neighbor? And where is Norway? Norway is, as you can see on the map, in Northern Europe, and not too far from Sweden, borders Sweden and Finland. It's a relatively large country and not a very densely populated country. Some stats on Norway, just so we get a sense of comparison between the US and in particular Connecticut and Norway. The total population is 5,400,000 people, and the density is, as I mentioned, pretty small, so it's only 35 people per square mile. And you'll see the prisons all around the country. There's vastly more prisons in Norway, and that's primarily because they're smaller in size and they're located closer to where people live. The largest city is Oslo, of about 580,000 people, and the median age is 39.7 years. Gender breakdown is roughly 50-50. The demographics, which is really interesting, because I searched this all yesterday, and as opposed to the US, they base it more on where you're from. So it's Norwegians are 83% of the population. It's a vastly white population, and Europeans make up about 8.3% and others about 8.5%. So how does that compare to the Connecticut? So our total population is 3,500,000, so about 2 million less than Norway. The population density is much greater. The square mile size of Connecticut is a lot smaller than Norway. So we pack 738 people per square mile in Connecticut. Our largest city is Bridgeport. And it's 143,000 people, and our median age is roughly the same as Norway, 40 years, which is important because it's not we're about the same age. So, you know, in terms of the risk of offending, we understand that younger ages are at greater risk of offending. So there's not too much difference there between Connecticut and Norway. And the gender breakdown is actually greater female to male percentage in Connecticut. Our demographic is, again, we're primarily white, about 76%, 10% Black and African American, other 5% Asian, 4%, and 2 or more races, 3%, and roughly, I believe, about 15% ethnicity is Latino. You can see the prisons there that we have in Connecticut. Not all of these are open. Some of them have been closed. Actually, in 2017, Governor Malloy announced the prison savings as a result of a lot of these closings, and it roughly was about $30 million. And so some of them aren't in existence, but many of them still are. So prison rates, and this is important because in the video you had England, the UK was going to study Norway, and the reason being, as you can see there, their prison population in the UK is 80,000, And their rate of incarceration is 148 per 100,000. Now, if you look at the US, our prison population is, and as we all pretty much know on this call, but for some of the CTN audience you might know, is the US has roughly 1/25 of the world's population, yet a quarter of the world's prison population. And ours is 737 individuals per 100,000. If you look at Connecticut, we've actually decreased our population quite considerably from a high of around 20,000, where our rate was roughly 436 per 100,000 to, those numbers are actually from yesterday, 11,100. And our population rate is now 300 per 100,000, which is vastly improved since where we were at. Then you see Norway, where their prison population, again, remember, they had 2 million more people than Connecticut, is 3,000. So that means roughly 66 per 100,000 individuals are incarcerated. And one of the things that I think it's important to note is that the Norwegian Correctional Service, in their policies and procedures and the laws that govern them, are what helped to shape that system. And I have a few slides here just on the correctional service. And one of the things that's important to note here is that the service in the country is governed by the Execution of Sentences Act, which says that a sentence shall be executed in a manner that takes into account the purpose of the sentence, that serves to prevent the commission of new criminal acts and reassures society, and that within this framework ensures satisfactory conditions for prisoners. And the values are openness, respect, professionalism, and commitment. In Connecticut, we have a similar act. It's within the Sentencing Commission's statutory language, and it roughly says the same things. However, how that's instituted in the correctional service is a little bit different. And that is because there's what's called the principle of normality. And that means that the punishment is the restriction of liberty. So this view of how people are punished is strictly limited to taking away their freedom. No other rights have been removed by the sentencing court, and therefore the sentence offender has all of the same rights as all other who live in Norway. No one shall serve their sentence under stricter circumstances than necessary for the security in the community, and therefore offenders shall be placed in the lowest possible security regime. During the serving of the sentence, life outside will resemble life inside will resemble life outside as much as possible. And it's, of course, limited, and yet the basic principle in there and deviation from it would need to be based on argumentation. That means you need a reason to deny a sentence offender his or her rights, not to grant them. And how this impacts the way that the officers work inside is important as well. What's different in Norway is that prisons don't have their own staff delivering medical, educational, library services. They're imported from the community. And this is important as we talk about reentry here in the US and in Connecticut. Different faith and clergy services are provided through the import model. And the advantages, as they see them, are a better continuity in the delivery of services, involvement from the community with the prison system. That means the community helps to own the reintegration, and the services in question are financed by other bodies outside of the justice system, as they are parts of the rights of any inhabitant of Norway. And then the progression towards integration, in accordance with the principle of normality, progression through a sentence should be aimed at reentering the community. The more institutionalized a system is, the harder it will be to return to freedom. Therefore, one will proceed towards release gradually from high security prisons to lower security through halfway houses, and finally execution of the sentence outside prison, unless security reasons dictate otherwise. So, the prison we're going to focus on today is Iceberg Prison. It's in Inner Østfold, and you can see it on the map there. It's not too far from Oslo, the capital that we talked about. It's a bit southeast of it. And it's a unit with a high level of security for men and has roughly 102 seats or beds. The prison has an organized service for 20 25 to 40 young inmates between the ages of 18 and 25 in an intoxicant ward according to the Stiffner model, and will, in addition, receive all categories of it. So it's at this point that I'd like to introduce Ellen Shee. And Ellen started working in the correctional service in 2007. She worked 10 years in Oslo and then changed to Eidsberg in February 2017 when they opened the brand new facility. In Oslo, her job was as a prison officer over 20 inmates. She carried out daily routines, and 2 of the inmates had her as her primary contact officer. That means that she was the one that assisted with them so that they could start preparing for the reentry to society. When she started at Eidsberg, she got a new position as first officer. That entails her having the responsibility of the prison when she's on her shift. For the past 1.5 years, she's worked daytime as the first officer, and she's in charge of 35 prison officers in 3 different departments. One department has with inmates with major mental health problems and aggressive behavior that can't interact with other inmates, and another is the operations center, essentially the control center. The third is the visit department that she also has responsibility of. And so Ellen, we met through our MSW intern, Kelly Ladd, who visits Norway in the summer and happened to visit not too far from Halden, and also not too far, Halden is the prison that was in the video, and not too far from where Ellen is. And so we connected with her in early February. We first talked on February 27th before all of the COVID started hitting here and there, and we've had about 3 or 4 subsequent conversations with her just about life inside there, how COVID is impacting them, and we just thought it would be fascinating to open up that conversation to a larger audience. So, Ellen, I have the pictures lined up if you want to introduce yourself and then start running us through the pictures and telling us a little bit more about Eidsberg.
Yes, thank you. Happy you would like to join me, have me there. I will try to take you through the prison when we see the pictures. This is an overview. You see the yard, and in the background you see the main prison with 96 beds. And the little house, yeah, that's my floor. That's the old prison from Eidsberg prison. It's 160 years old, and it's small. It's we only have 10 cells and 2 security cells. Yeah. This is from the main building. Everybody has their own cell, and they have own bathroom. There are no doors from the bathroom to the living area with a bed and the table. But this is the bathroom. It's a shower, a toilet, and a sink. This is the football field where they also can play basketball outside. And this is a visit room. We have 5 visit rooms are looking similar like this one. This is the we use most when we have kids. It's the biggest and the nicest. It gets a little bit. It has a little bit more space so they can play and get around, because they are locked in this room during the visit. So this is a typical children visit room. And this is a cell from the old prison. Then you don't have your own bathroom. You have a toilet in the room. It's not that luxury. And this is the common area in the. We have 8 floors, different 8 departments with 12 inmates in each. And this is the common area when they can look at TV together. And this is their kitchen, where they share. This is one cell, then you see the bathroom from outside, and the bed, and a table. And they have a little fridge under the table, so they can have some food in there also during nighttime and lock-ins.
There's also a TV in there, Ellen, right?
Yep.
And
Yeah.
what, are they able to get on the TVs?
Yeah, they can have the TV on whatever they like. And now during the COVID, we have put a lot of information and other things on the TV too, like yoga classes, guitar classes. Yeah, different type of activities they can do on their own.
Okay, well, that's a little overview of Ellen and the Eidsberg prison. And now I'd like to bring on to the conversation our former commissioner, Scott Semple. Scott, as I had mentioned earlier, has had the benefit of traveling to Germany and to Norway. And I know we all on the call miss Scott here in his presence in the state. And we're so lucky to have him. And so what I'll do now is just step away. And I know Scott and Ellen, I think, are going to talk a little bit about the differences between the U.S. and Connecticut and what had Scott had been doing under the former administration here in Connecticut and what's been happening nationally with that as well. So Commissioner Semple.
Good day, everyone, and thank you for the invitation to be here with you today. Andrew is correct. Shortly after, during my tenure as commissioner and the first year of my commissionership, I was invited to go to view what was referred to as the European model, and this was in Germany in 2015. And I didn't know what to expect and began to do some research as to what that began to look like. But I was excited to see a different model that was very different from how systems operate in the US. I have been to various systems in the United States and still go in a consulting capacity to various systems around the US. So I was invited by the Vera Institute of Justice to take this trip. It was my first trip to Europe, and lo and behold, I'm visiting prisons. But that being said, I had the benefit of traveling with Governor Malloy and Undersecretary of Criminal Justice, Governor Malloy's advisor, Mike Lawler, who attended a tour of a few of the facilities that we saw while he was on vacation in Prague, and took a train over to Berlin. So we went to 5 different facilities, and everything was very intriguing to me, what I got to see. But there was this one particular experience that I had at one particular facility in the Western Pomerania, Mecklenburg area or region of Germany, which was a facility that was dedicated strictly for emerging adults. That's 18 to 25-year-old folks, and they believe in the notion of brain development and everything that comes with that, and that this is in particular a very impulsive population from the perspective that their brains are not fully developed. And so another aspect that was very intriguing to me is that during one of the visits, everything seemed to be very quiet, very calm. And I was watching how the correctional professionals were engaging with the population, and it was very different. It wasn't coddling, so to speak. There was still some level of accountability, but there was an engagement and commitment to help and assist incarcerated people who were in the system. And so the one question that I asked during that tour was, at one specific facility, which was equivalent to a maximum security environment here in the States, is how many incidents have you had in the last calendar year? And the answer was 0. And that got my attention. So we traversed up to Mecklenburg area of Germany and went to this one particular facility. And I was so intrigued that they accepted the thought process of impulsivity and brain development, that they knew that it was an impulsive population, but they were still committed to take a more synergized and clinical approach to meet the demands of that specific population. And I felt, and with my discussions with Governor Malloy at the time, that this is something that we could do here in the States. So fast forward, we returned back to Connecticut, and I began to do the research. Could not find a lot of information that was specific to brain development in correctional environments, but I could understand the dynamics of brain development and how it may impact the correctional environment. So we did a simple query. We queried the amount of people who were in the Connecticut correctional system, 18 to 25, and then we evaluated what percentage of incidents that they were involved in. And what we found back in 2015 was that there was approximately 3,200 incarcerated people, and they were responsible for about 25% of the incidents that were occurring in the system. So I challenged the staff, let's try something different. This is what I was fortunate enough to see in Germany, and I think that we can mimic it here in Connecticut. That was a very interesting journey for me. I felt my job was to influence the concept, but also to empower the people that we were relying on to implement the program. And the True Unit was born, as it's referred to today, and as many people know, has received a lot of national accolades, and ultimately has expanded to the Worth Unit and all kinds of aspects of different variations of what was being done in Germany was implemented in Connecticut. And one of those variations was the utilization of mentors, using incarcerated people who more often than not have been incarcerated from a very young age, are older now in the system, to invest in them and train them along with the staff. They were trained separately, but we wanted them to take on a mentorship role. And the reason I bring this one specific thought process to your attention is that that wasn't done in Germany. And the science would tell you that it's not wise to mix older populations with younger populations because of the whole notion of manipulation and vulnerability and everything that comes with it. But in the interest of empowerment, we had to try, I had to allow for that to occur. So I made the decision to say, go ahead and try it. If it doesn't work, we can fix it. And the mentor-mentee relationship was born. Ultimately, what happened from that, because I expected some impulsivity, we were not targeting a population that we felt were not going to be a problem. We actually targeted populations that we felt had a history of acting out during the course of their incarceration. But what had happened because of that relationship is they're 3.5 years into this now, and as far as I know, I've been retired for a bit over a year, there has not been an incident in these units, which is very intriguing. So let me just fast forward really quick. So that was 2015. We implemented the True process and the emerging adult concept. And then in 2018, I went back to Germany, but also visited Norway as well. And I visited the facility that you just saw on the little segment of the Halden prison. And I was very intrigued. What I would say is Connecticut is, a typical correctional system that you would see in the United States. The infrastructure for our prisons is all about efficiency, how many people you can get into this building at the cheapest price, and not necessarily to the degree of the European model invested in someone's well-being post-incarceration. We try, but not to the degree that it's done in the European model. So Germany was very progressive, and then we land in Norway, and that is Germany on steroids, is the best way to say it. And the Halden prison is essentially a campus. It's one of their newer facilities. And one of the things that we learned about at Halden, and you mentioned it, Andrew, is the thought process of dynamic security. And I think Ellen would be best to give some perspective on that and also speak to the thought process of principles of, as you referenced, normality, that in essence is what we utilized here in Connecticut with the implementation of the the emerging adult concept. But what I will add to you is that when you do these things, it's a journey and it's all about empowerment. And if you watch the dynamics of the competencies of the correctional professionals in Norway and in Germany, you know that they are empowered, they are well trained and educated, and they know what their role and responsibilities are, and they know that the system is taking a clinical approach, and they are part of that process. So there's a mutual reliance that is there. I always would challenge the staff is, do you want to be a department of correction, or do you want to be a department of incapacitation? And that makes people think that our role is to correct people. Our role is to assist people. Our role is to maintain some level of humanity and a dignified approach. And when you're able to do that and make the proper investment, the outcomes are vastly different. So we don't know what recidivism will look like as yet. I'm sure the next study for recidivism in Connecticut should be coming out soon. But I always warn people, along with whatever that recidivism number may be for this specific emerging adult population, you also need to measure harm, because a lot of these folks, because of impulsivity, have committed or have been convicted of acts of victimization. And that may not be the case if they're reincarcerated. And that too equates to success.
Thank you, Scott. Ellen, do you want to remark on that at all?
It sounds familiar what you've been experienced in Europe and in Norway. I just wanted to say a little bit about the way we work, and we working with the principle of normality, and that also reflects our education. We have a two-year education at the staff academy, and we have topics like psychology, criminology, law, human rights, and ethics. And we have a huge focus on respect and mutual respect, just to interact together. And yeah, that's what you can. It's and we also I've also learned a little bit about the brains of young children, especially young men. And it's really, really interesting. And we have this focus now on communication, and we try to use communication as much as we can. And that is really exciting. You can see a huge difference if the way you communicate with the people that are angry or hurt. The communication, the way you communicate to them is really, really. It's interesting. The different ways you can communicate can either rise the anger or take it down. Really, 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 really down. So yeah.
And
yeah.
I wonder, and maybe this is something that Commissioner Semple could talk about as well, is how much that has to do with training. Because I know in the conversations that we had with you and you described your training, I think it might be a little different than what we experience here. Can you just tell us a little bit about how officers are trained in Norway?
Yeah, like I said, we have this 2-year education. We receive pay during the education. The 2 years, we have 1 year working and a little bit school at the same time, and 1 year full just school. And we are also And when we work we were sent around the country. They decide where we will go. So they just ship us. You see, from the northern Norway just to the south, you can be sent anywhere. But if you have kids, you probably get to stay around where you are from. Then we work. We have a supervisor. During that year, we are out in the facilities. We train on physical things, communication skills. During the 2 years, we train all about these things all the time. The school year it's the subjects. That's mainly the subjects. But we have the supervisor on the school, and when we go to the facility, we have one supervisor who is giving us feedbacks all the time. We have tests. We have to pass the physical tests, the written test. Yeah.
Thank you so much. And what I'd like to do now is we have a series of panelists that are going to be joining us from different perspectives, and from the public health, justice impacted, legislative, children and families, municipal, community and advocacy, who will be joining us for the conversation, and may be able to ask Ellen a few questions from each of the perspectives, for a few minutes each, just so we can get a sense of not just how the system was designed and how it had been operating, but potentially, because this is one of our focuses now in the midst of COVID, how you've reacted, what the system has done there, and how that's impacted your life and the life of prisoners there. And I want to thank so much Commissioner Semple for joining us. I know he does have a call he has to hop on to. You're welcome to stay until you do have to leave, Commissioner Semple. I'll offer you any last words if you'd like.
No, I just thank you for the invitation. I wish I could have spent more time with you, but the call to do this came in less than 24 hours ago, and but I wanted to be involved, and I see a lot of familiar faces on this panel, and I wish you the best. I also am praying for the incarcerated population and the correctional professionals in Connecticut who are dealing with this COVID dilemma. And my wife asked me recently, after being in quarantine for a couple of weeks, "Aren't you glad you retired?" And I am, because this is like new territory, and I know a lot of people have a lot of strong feelings about how corrections is handling this COVID dilemma. And I know that there are some wonderful correctional professionals and a committed administration and committed frontline people who are trying to do everything that they possibly can with limited resources, and they're trying to get what they need in order to improve the health and wellness of the population that they serve. But I think it's important for me to say that, because I know, reading, I'm just a regular citizen consultant guy doing this emerging adult stuff around the country now. So my view is the same view as every citizen in the country, is what I read and hear about in the media. But I know behind the scenes that these people are trying to do everything they can to protect this population. And I also pray for the families of the incarcerated as well. So I thank you for having me today, and I wish you all the best. And I think it was a wonderful idea to invite Ellen on, and I hope someday she can come and visit the Connecticut system as they progress to a more humane environment. Thank you.
Thank you so much, Commissioner. And yes, we certainly appreciate your willingness to join us in such short notice. It was the same thing with Mike Lawler too. But your expertise, your understanding of the system, your compassion, your dedication is just evident. I thank you so much for being available.
Be well.
It was so good to see you.
You too.
And I would echo that, with us within the reentry community, working especially with Trina Sexton, who was the director of reentry, working night and day to try to make sure that end of sentence individuals aren't being released homeless. There's a lot of complicated factors in this, and it takes everybody in the community, especially to help out in figuring out how to do this safely and effectively. So thank you so much for your thoughts.
Be well.
And one of the things too, in terms of Ellen, that I'd just like to say to everybody is, the commissioner has been out there, and I believe Commissioner Cook has been out to Germany as well, and the former Governor Malloy has been. But one of our thoughts has always been, it would be great to have line people go out there. It would be great to have a former correction officer. It'd be great to have, or current, and maybe even a parole officer, probation. It'd be great to have family members of loved ones go out there. It'd be great to have folks in the nonprofits, municipal reentry directors, maybe someone from the public health perspective go out there. And although that travel probably won't happen anytime soon, we are doing that virtually. So that's the next part of this conversation, and trying to get a sense of, as Commissioner said, when he asked about the number of incidents, and he's thinking about that from a commissioner perspective, that's a valuable perspective to get. Now, I'd like to bring on our other guests to see what questions they would have if they were in Norway, which we virtually are right now, and what are the types of things that they would like to know about from their perspective. So right now, I'd love to bring on Dr. Lisa Puglisi, who has joined us on every call. She's a familiar face from Yale and the Transitions Clinic, to ask Ellen and have a 5-minute discussion on the public health perspective.
Thank you. Thanks for having me with you again, and this is an exciting opportunity. So the U.S. differs also very much from Norway in terms of who we incarcerate to some degree and why, and the association with medical illness. We know that medical issues in health are actually very important to incarcerated people. So framing it in the lens that Ellen provided us in terms of mutual respect, in 1971, in the Attica uprising, before the uprising, there was a manifesto of the requests of the people who were feeling not listened to in the prison. And number 2 on the list of requests was access to adequate medical care, not provided by other incarcerated people, but by medical professionals. And I say that to say that we know that this is important to people who are incarcerated. I hear from family members all the time about how they worry about the health of their incarcerated loved ones, and especially now in the time of the coronavirus pandemic, that is, worry and fear on steroids, with health on the front of everyone's mind. And so I think in terms of, we are working in our state to try to build out a health system that is more connected, more seamless, and where interruptions in medical care then don't cost people their lives for other reasons. And so it would be so interesting, I think, for us all on the call to hear about how medical care is delivered within your correctional system and how people are linked back to care once they're back in the community.
We have a health system in the prison. We have these nurses 5 days a week. We take people out to the hospitals and other specialists. I've been to a hospital in Oslo today with one guy. He's going blind on the one eye, and that was because we don't take people out right now through the COVID, but that's critical. So we need to go with him, and 2 officers take him to the hospital in Oslo to check his eyesight. So that's how we do it. No, they don't come in. But so the ambulances pick up the people, maybe heart attacks, things like that. So we don't have that inside. We use the normal system, and we go out to take them outside. But we have the nurses here 5 times a week on a daily basis. That can assist with, they do a lot of good work. They have conversations, they help us and we help them. And we have a psychiatrist
who's on staff and works in this?
Yeah, from the he's not paid by the correctional service. He is from the community outside, like the health care is that import model. Yeah.
Great, that's so helpful. So to summarize it, it really sounds like the focus in your country has been on maintaining community health.
Yeah.
For people who are incarcerated. We have a slightly different, system here clearly, but it relies on the community system to provide medical care. And since you have sort of smaller prisons and local communities, it sounds like people are then released back to probably same community that they've been getting their health services the whole time.
Yeah, yeah, and their own doctor that they have assigned outside. They also have contact. They can also have contact with that person inside by telephone or if we need to.
Oh, great! That's so helpful to hear. And I don't understand that you guys have been severely impacted by coronavirus, but can you give us any insight as to other, have there been other large, epidemics of infectious disease in your correctional systems in the past or anything like that, and sort of how you guys end up managing those?
No, we really don't. We have the biggest problems we have is when they have this when the normal flu is going around. A lot of inmates gets it, but again we have separate rooms. So when you get sick, you're inside. You are inside your room, so it doesn't spread that much. So
so there's not crowding and sort of communal living.
Occasionally we have no, and if they're sick, we tell them, okay, stay home today, don't go to school, don't go to work, and then they can have the day at home.
Right, gotcha. Thank you. And lastly, I don't want to take up too much time, but one thing that we're seeing during our coronavirus outbreak is it has affected quite a number of incarcerated people, but is actually also impacting correctional officers disproportionately. So the rate in correctional officers is even much higher than the rate in incarcerated people. We've known here for a long time that even just being a correctional officer can actually have negative health impacts in the US, probably due to chronic levels of stress and other risk factors. But I wonder if you could educate us at all about sort of correctional worker health in your system and whether you see similar negative health impacts on people who work inside the system.
I do. I do. I'm sad to say, but yeah. Here we put it, they're working shifts. 3 shifts a day, night shift, day shift and night shift. And that has a big impact on many people are struggling to sleep. And when you don't get sleep, you get other diseases also. And that, but that's why I have to stop working shift, because I couldn't sleep at all. Not a good thing. So, and you see the level of stress, people, the experiences they're taking it, every day something happens, and it's okay. They are coping, and suddenly it hits them. It's too much. So the stress level and the working hours and all these sometimes negative things. It inflicts people's lives. Even if you go home, you have it in the back of your head, and that's what we see with most people struggling with.
Great.
And that's what I miss the most here, because we don't have a support system is good enough. That's one of the things I want to. That's one of my things, because we nobody picks us up.
Yes, interesting. And I think we could probably share that experience as well. So looking for new solutions in terms of that. And then one very, very last one is, you know, what we hear a lot from families of incarcerated people is, again, how they worry about them. Here, there's a sort of distorted system around high cost for phone calls, and it's not easy to keep in touch with loved ones. Can you tell us about, just briefly, about sort of how incarcerated people are able to maintain relationships with family and what you do to promote that, as we know that that also impacts people's health as well?
Yeah, of course. We have doubled their minutes on the telephone. They have 20 minutes normally in the week. Now they have 40, and it's for free. So they can reach their families and loved ones. And we also have got these tablets from the Red Cross and the correctional service together. I think we have 12 tablets, so they can use the video visits for inmates, and they can do that. They have one and a half hour each time, and normally they have one visit a week. But if you have the capacity, they can have more. We also have the opportunity to Skype. So we try to do these things as much as we can, so they can stay in touch.
Thank you for all your input.
Thank you. And thank you so much, Dr. Puglisi. And we'll have a little round with everybody after each of the panelists gets to ask their questions. Now I'll move on to Daryl McGraw, who works with us at the IMRP and helps with the Connecticut Reentry Collaborative from the perspective of a justice impacted individual. What questions would you ask, Daryl, about to Ellen about life in Norway?
Oh, man. Well, thank you everybody for joining us. Thank you for everybody that's joining. Thank you again. It's good to talk to you and see you again, Ellen. Thank you. Sorry for the little technical difficulties. You know, we're trying to make it work. So much. It was a lot of really good conversation, and I really appreciate it, especially those advocates and formerly incarcerated people on the line. I'm sure we're all buzzing for different questions. So I'm looking at the chat box. There was a couple of questions, and I'm gonna hold off because I'm gonna see if they're asked. But if not, I will come back to them. My question is, I think it's more of a statement where the principle of normality. I think that, you know, if we could really build off of that here, and you could talk about more of that, you know, that principle of normality. I also like the, you know, we could start there. Like, how did you guys come about instilling that? Like, what was the idea? Because here it seems like everything is punishment from the time you get arrested all the way through the system, and even after release, we're still suffering from the ramifications of incarceration. So could we talk about that principle of normality? Because I think it's something we should look at instilling on this side of the fence.
Yeah, well, we can. I'm not really familiar with the where it all started. I don't. 20 years ago, we shifted here in Norway to. Before that, we also were all about punishment. Not all about, but mainly. And it's we try to bring it into everything we do, everything we offer, in the daily routines.
I do know that, Daryl, one of the things that we found out in our calls was the fact that people's records are hidden upon release, and that would most likely help out with impacted individuals as they try to gain employment and the like.
The other thing that I really like that, you know, you guys are described as, and, you know, I'm loving that we're building this relationship with you and your organization as we move forward, because you are like Connecticut in the United States. Connecticut is built as one of the most progressive systems. Like you know, when it comes to criminal justice reform. Now, I'm sure many people on this call will beg to differ. Myself included. I mean, we definitely have come a long way, but there's some things that we could do a lot better, especially when it comes to reentry. But one of the things that you guys are touted as in the film that we saw was that you're the most humane system. And how do you feel about that? Do you feel like, from a formerly incarcerated perspective, seeing the TVs and the cell setup, if I was to do crime, I might come to Norway to do my time. But just from a humane, it says you guys are the most humane. What do you think about that?
Yeah, no, somebody may think, oh, that's too soft to say that it's humane, but I think it's just normal. It's that again, it's just the normal way to interact together. You will be humane to people you meet on the street. You can be humane to people you meet in the prison. It's basically all natural.
Mm-hmm.
And it goes around. It goes good with we're working with the dynamic security, not a lot, and that's being part of the common areas in the prison. The prison officers are supposed to be in these common areas together with the prisoners.
Right.
That's the best security we have.
And last but not least, one of the things they were talking about was the investment, because you guys are investing in people, and I love that concept. And I always talk about, like, when we're talking about like ROIs in the business world, we talk about ROIs, like return on investment. You guys are investing in the human beings, but not only just the people that are incarcerated, you're investing in your staff. Has it always been that your training process has been 2 years, or did that change at some point in time? Because I find that to be valuable. The more you invest in training, the better your employees are, no matter what business you're in.
The staff academy is old. I don't think it's always been 2 years, but the system has been in modern days. It's been like that.
Okay. All right. Thank you. I have a million more questions, but I will share the time.
Yes. And now we're going to go on to the legislative perspective. We're luckily joined by State Representative Robin Porter from the 94th District in New Haven, and who's been on all of our calls so far as well for Reentry Reform Month here. And Representative Porter, you have the mic.
Thank you, Andrew. I appreciate that. And thank you all the panelists, and thank you to Ellen for just being a part of this and enlightening us on many things that we can be doing better and enhancing things that we already do here in Connecticut. You mentioned that you have prisoners who cannot interact with other inmates. So I wanted you to speak to that, because here in Connecticut, we are definitely fighting to end solitary confinement. We actually have a supermax prison here by the name of Northern that we're also fighting to have closed. And I'm just curious as to, how do you deal with the population of inmates that you said cannot interact with other inmates?
It was maybe a little bit unclear, but in periods of the prison time, there are different problems. And in these periods that are in the most troubled, in my floor, we put them in. They have their own cell there. You have more time with them alone, one-on-one. And as soon as they are feeling better, things are going a little bit better, we send them back to the open floors again to try. So we don't isolate them too long, because then they are staying there. So we try them out and take them back if it's gone wrong, and we send them out again. So we go back and forth till we find out the way that they can function. And with help of the psychiatrist, sometimes medication, of course, and the nurses and the officers. We have a lot of conversations and talks with them. And
thank you for that. So most of it is around mental health and the way that you deal with the issues that they have, and you put supports in place for that. It doesn't pertain to, because I do believe you guys have zero violence, and I think that was the other thing that really was striking to me and stood out, that you have violent inmates, but you don't have violence in the prison. So can you kind of speak to what you think that is and why that is?
We have some. I heard him say that there was no violence, but we have things happen here too. They do, but it's not much. It's not much, and mainly it's because of the dynamic security, because the prison officers are together with the inmates most of the time, and they are so they're not and I think that's the most, and the communication part and the dynamic security is I think that's the biggest issues in that, to keep it calm.
Okay. And then my last question, so that they can move on and other panelists can get in with their questions, is, I am actually a parent of a son who was previously incarcerated, so I do have personal experience with the system, but I also get to talk a lot with the inmates that are currently incarcerated. And the thing that always concerned me, right, we talk about human dignity, and Darryl spoke to, you all being known as having the most humane system. And to me, humanity and dignity are very important. And here in the state of Connecticut, I find that inmates are dehumanized. And I'll give you an example of what I'm talking about. Like on visits, they have to literally strip down totally naked and go through this process that is very dehumanizing. And I want you to speak to what's the process in Norway when you get a visit. I mean, just speak to that and tell me what is the difference in how you guys deal with them having contact with the outside world versus how we do it here in Connecticut.
We also have visitation after the visit. They go they go to the visit rooms and have the visit, and when they are finished, one and one gets inside one locked room, and then they have to take off their clothes, then the visitation. But we have this we do it half and half. We take the visitation is you take the bottommost first, and then you get it back, and then you take the top. You understand? If that makes sense?
Yeah. You're cutting in and out a little bit, and I'm getting bits and pieces, so I just want to make sure
you hear me now?
That what I'm hearing is correct. So is it a full body strip, or do they remain in some of it? Like, how does that work?
Yeah, everything the visitation is, first you take half the bottom off, and you go through the clothes, and you get it back, and you take the top. And that's something we've started with recently. Before that, we also have the full strip. Yeah.
Okay.
After the visits.
Okay. All right. Thank you for that. Thank you, Andrew.
Andrew, Britt, who's next? And thank you, Robin, for those questions. I think we get the gist of what Ellen was saying, that there is still, after the visit, there is that strip search thing. And having been through that, as a parent, you're sitting in a visit, and then after that visit, you're the dad at the table and you're interacting with your family. And then 2 minutes after that, that's all stripped. When you go to the when you go through the strip search process, that is all stripped of you, and you're reminded of where you're at. So, I mean, and that's something that never leaves you, regardless of how many years you've been out of prison. Just the thought of that, so that is one of the most dehumanizing things that I've experienced through prison. So I really appreciate you bringing that up. And Ellen, and saying that, what, we understand safety and security. So Ellen saying that process still happens there. But even in that process, they let you take off one part. You're not standing there in front of a complete stranger, totally naked. And it seems like there is, even through their process, there's a different way to do it. Take off your bottoms, put these up, now take off your shirt and so on and so forth. And in the situations in Connecticut, it's not the exact same. So I think I appreciate us having that conversation. Who's the next person on that we got? Andrew.
Right. Next up, we have Aileen Keys from our CIP initiative, Children with Incarcerated Parents. And I know we've been talking about families, and Rep. Porter brought that on. And thank you so much, Rep. Porter, for being a part of this. We saw a picture of the visiting room there, Aileen. And I know that right before the COVID hit, we actually went to Cybulski to see the new visitor center there. And maybe, some thoughts on that and some questions that you have for Ellen on the family perspective.
Yes, thank you. Hi, everybody. Can you hear me okay?
Yes.
So one thing I just want to quickly touch on that Ellen had mentioned, or actually Andrew had mentioned it in his PowerPoint, was that Norway's entire population is about 5 million individuals. And it struck me because in the US, it's estimated that there are 5 million children, or 1 in 14, who have experienced the incarceration of a parent whom they have lived with. And so it just struck me the similarity of 5 million, but it's for vastly different, describing vastly different experiences. So certainly there is population differences between our nations, but also I think even though that would allow maybe for greater resource allocation to the correctional system, I think many of us would still argue that resource allocation is also a sign of our values and what we believe to be important. And so anyway, but yes, going back to the connection between incarcerated individuals and their children and families, we do know from research, and I'm so glad that Dr. Puglisi mentioned this from a public health perspective, we do know from research that parental separation, having a parent incarcerated, has been identified as an adverse childhood experience and has been identified as having a similar response in the body as trauma, experiencing trauma, and it can realize brain architectural changes and brain damage and result in a host of health consequences, but it also results in health consequences for the incarcerated parent. However, maintaining the connection and communication has been identified as unique in that it can help to alleviate a lot of the negative health reactions. It can decrease levels of cortisol that are dangerous and increase dopamine. And so in Connecticut, we were very fortunate that very recently, as Andrew mentioned, we redesigned our visiting room in 2 of our prisons to make it more child-friendly and family-friendly. And families can sit together the entire time. They can touch, have full contact during the entire visit, which is not how it is in the rest of our facilities. The photo that you guys showed that Ellen provided showed a visiting room that was also very family-friendly, where it looked like they could have full contact. If you could describe maybe a little bit more, Ellen, what a normal visit is in a typical facility. Is it in a place where they can have full contact and they can really engage and play? I thought you had said when that photo was being shown that was one of the popular rooms, and it almost feels like maybe they can have almost alone family time in that room. Can you discuss that? Oh my God!
It's a separate room. So when I'm a prisoner and my family and kids are coming to visit me, we're going into that room, and I will come in afterwards, and then they will lock the door, and we can be there all by ourselves.
That's remarkable. I mean, that really helps with also allowing to practice parenting and to feel like a parent again, which helps with identity that Daryl kind of, I think, touched on a little bit or hinted at with the identity of being a parent when you're in the visiting room and then you go back for your security check and all of a sudden you're humanized again. And that's really remarkable. A lot of our correctional staff are concerned with contraband coming in through visits like that. And certainly we can't prevent everything from coming into the facilities. And we know there are a few mechanisms that contraband can come into facilities, the mail, staff, families. But have you noticed in facilities that have that type of visits, if there's an increase in contraband exchange?
No, not that I know of.
Great.
No, not quite, no.
That's great.
Not experience, no.
Another question. So in Connecticut, we have the Department of Social Services that has a fatherhood initiative, and they held focus groups with fathers that are involved in the criminal justice system here in Connecticut. And one thing that was really striking in the outcomes was a lot of fathers talked about how the fact that their father was either completely ignored or actually they felt held against them, that they were treated more harshly if it was learned that they had children. And the father's perspective was that it was, well, you have kids, how could you do what you did because it's hurting them, and that they would actually be treated more harshly. Yeah, in the video, it seems as though your system kind of recognizes them as fathers and mothers and respects that role to a degree. Can you talk about maybe some other ways, in addition to communication, that they're recognized?
Yeah, a lot of inmates that are dads, they need to talk about it. They need to talk about the children. So we do that, and that it seems like they're helping a lot. But they just have to recognize that they are a parent, and they show us pictures of their kids, and I think that helps. We also have not this year, but last year we had a daddy program, father in prison program, and that also was a really good one, and that helps it. It's become a little bit more okay. They're struggling, but it makes it a little bit more okay for them.
Yeah. And for us, we think of it as, for most of us, a primary motivation to do well in life is our children. And so it just seems for us to make sense that children be a primary motivating factor to realize whatever changes you need to make in your life and your behavior. So it seems to make sense to bring it into correctional facilities.
Yeah.
Speaking of which, in reentry planning, do you guys in any way more formally involve families? One thing we're looking at that now. We're part of a national family connections project that we're looking at piloting different things, and we've already done several things, but it'd be wonderful to learn what Norway has done or is doing that maybe more formally involves families.
Yeah, we involve the family if the prisoner wants it. It's their decision who they want to involve in their reentry process. If they need to have more contact with family, kids, we try to help them with that, if that's the way of getting back better. But it's not a program we have or something. It's just part of the normal day, actually. It's the way we think about it. And we start with the reentry. We always bring in family and the support system. Who do you have? Who do you need when you get out? Who do you want to come in contact with? Some inmates doesn't have the contact with their kids or family in a long time, maybe. So they need help to get started. And we can do that. That we do also.
Thank you. One last question, if you don't mind. I'm so impressed that Norway commits such a good amount of time for training. And that's one thing we've been looking at in Connecticut. Also, we piloted a training at 2 correctional facilities at Willard and Cybulski for corrections staff on children and families. And it talks about the trauma the families and children have experienced, either through things that happened in their lives outside of their parents' incarceration, or from going to the facilities, and how children and families experience coming to a prison for a visit and how they experience interacting with the officers. Does your training involve any curriculum related to families and visits, maybe?
Yeah, we have visits from, we have this prisoner next of kin program is not the right word, but it's an organization for the next of kin for prisoners, and we are using them during the training in the school.
Excellent.
Is that the Way Back organization that you have?
No.
Oh, different one. Okay.
No, yeah, a different one. They also have programs for the prisoners' children, so they can meet other children with the parents in prison. They take them to movies, to pizza, they can meet other kids with the same
That's so important.
Yeah.
Great. And Tammy, we've known She was a former probation officer, now retired, but heads the criminal justice component of the Connecticut NAACP chapter and the National Association for the Advancement of Colored People, and brings a tremendous perspective. We've worked with Tammy on our racial profiling initiative, and I know Tammy has some questions from a community and an advocacy perspective. Tammy?
Great, thank you, Andrew. Two quick things. Firstly, I haven't heard much about mental health. And here in Connecticut and by extension, the United States, it's almost as if we've criminalized mental health. Particularly our mental health facility has recently been ruled to be cruel and unusual punishment. My question to Elaine is how do they work with, how do they address the severely or the chronically mentally ill? And my other question is related to racism in a sense that the, if we look at the origins of our penal system, it's alleged that it evolved from slavery, and that racism and bias is inherent in our penal system, in our criminal justice system. And it's the system here in the United States is unique to not only the history of slavery and racism, but the distrust and the broken trust between minority communities. And so my question to Ellen would be, how would she recommend that we deal with that component of our criminal justice system, the broken trust that I don't think is prevalent there in Norway?
That's a big one. But I can take the first one first. You asked the mental health problem, how we're dealing with it, and how we are doing it. We cooperate with the hospitals. That's to get the help they need, and then we try to help them, of course. And we have to isolate them sometimes, but we also try to get them into the groups so they can interact with others, because we have seen that that's helping them a lot, not to be isolated, because that often makes it worse. I'm not quite sure if I got the last one. Can you take it one more time?
I think the long and short of it is, I think racism is greatly impacted. Our criminal justice system is greatly impacted by racism, and I think that might not be such a factor in your penal system or in your criminal justice system. Yeah. And so when I looked at the video, I saw relationships in Connecticut, and like I said, not just in Connecticut, by extension, the entire country. There isn't that trust. There's a broken trust. There are people who feel like they have been, I don't want to use the term railroad, but it's perhaps probably the best term to use. So many people wrongfully convicted. Now, recently, we've seen numbers of people who've been exonerated after 30, 40 years of incarceration for crimes that they didn't commit. There is, between the minority community, a broken trust with the criminal justice system that I think it hinders us in terms of pairing our two systems. There's this huge elephant in the room that really goes unaddressed, and that's bias, that's racism. And so do you think we could either evolve or create a system like yours with the racism unaddressed in our system?
Yeah, but these things takes time. You have to, it's again back to this mutual respect. But we also have, we have issues here also. If the prisoners are not happy with the decision I made, that I'm often accused of being racist. So not everything is pink here either. But we can talk about it, we can discuss it, and we can agree to be not to disagree. We're not, but I think that the mutual respect is the ground in everything that we do, and but that has to come over time. It doesn't shift by from one day to another. You have to earn it, and that goes both ways. But it helps with interacting in the positive things, like out in the yard. You can play football together. We can do things together. Then it's easier to get there.
Yeah, and Tammy, if you don't mind me interjecting, I know one of the reasons why Germany was one of the systems that was taken a look at initially was because their experience with the Holocaust and essentially was a treatment of the other, which is, you know, what we talk about in the US with racism and othering people, immigrants or the like. And that allows people to be dehumanized. And in Germany, you know, our understanding of it is, you know, they learned from their experience with the Holocaust and what that allowed their society to do. And they completely revamped their laws and their ways of treatment of people in any type of confinement after that. And I'm wondering, Ellen, you mentioned Norway changed 20 years ago, but was there any motivating factor like that in Norway?
Something needed to be done because things weren't working. That's the yeah, as easy as or as difficult as that. And then they started to see that you have to have knowledge to work so closely with people. You need you need all these things we learned in these 2 years. We need more, but that's what we get. So that's the main things.
Okay, thank you. And now we're going to go to Earl. I introduced him earlier. I think, Earl, you're back on with your mic working and the camera working. Do you have any questions from your perspective as Director of Reentry in the City of Bridgeport?
Yes, I think I kind of got this WebEx thing figured out. Thank you guys for having me. I think these web series has been a great kind of forum for everybody to kind of get together and discuss this stuff during the National Reentry Month. Just a couple of questions. I'm just wondering, with the type of system that you guys have, so my main focus is reentry and having the individuals reintegrate back into society and the community that they came from. I'm wondering how that process works.
Yeah, these things is we start the reentry process at the beginning of the sentence. When they come in to the prison, the first day that we have this income conversation, when we found out what they need, the basic things they need, and what we can help them with, what they need help for. And then from there, we plan the reentry. No, somebody has a long sentence, so you have to make small things first, and then we start up again 6 to 9 months before they are supposed to be released. But we start really, really early, and we start thinking about it the moment they get in, on what we are going to do. Yeah.
So they're working on a plan for their eventual release as soon as they get into you guys' system.
Yeah. We start.
Once they're released, the state or the city that they're released into is providing resources on the outside as well to help reduction of the recidivism.
Yeah, if that's needed, we have different meetings, like the crisis response team before they were released. A couple of months, maybe 2 times before they get released, we put together this group of maybe if you have a drug problem, you need your drug consultant. You maybe have your doctor, your lawyer, somebody from the Social Security Service. They come into the prison to have a meeting and find out who has done what do we need to do, before they go out.
So there's a complete wraparound of services. You mentioned lawyer, you mentioned doctor, you mentioned Social Security, and is that protocol? I'm sorry, can you hear me?
No. Yeah, I hear you.
Okay, is that protocol uniform throughout every facility in every state in Norway, or are there different protocols for different states and different cities?
No, these are the protocol for Norway. Not everybody is doing it exactly the same way, but it's the protocol for Norway. And the prisoner and his contact officer is planning these things together. The prisoner has to get involved himself together with his contact officer, and they decide who they need to have in the group.
That's amazing. So it's very unlikely to have somebody that's going to be released into a state of homelessness, or somebody who's released with some critical need for their health care, or being released in some type of health crisis.
Yeah, we try to avoid that.
Gotcha. Thank you.
Thank you so much. And I know we're going to look to wrap up in a few minutes. We went a little over, but as normal, you know, these are engaging conversations, and you know, this is a unique opportunity. So we wanted to keep the conversation going. We do have a few more questions from Representative Porter, so I'd like to bring her back on.
Thank you, Andrew. Just really quick, Ellen, I was wondering, I mean, you spoke about the 2-year training that you all have in Norway, which is quite impressive to me. And I was just wondering, because I know that many of our correctional people, our police officers, people serving in those capacities in the state, oftentimes they have military background. And I was just wondering, in Norway, what does that look like amongst the correctional officers at you all's facilities? Do you have military background? Do any of your colleagues have a military background?
Some have it. I worked in a travel agency, so we have tons of different. Some have gone from teaching, from working in shops, everything. It's not that kind of everybody has been to the military first. No.
One thing I did want to mention is, I believe in one of our conversations, it came to light that roughly, is it 40% of the correctional employees are women?
Yeah. I think it's a little bit more, but that's the official number. I think we are getting close to 50-50 now.
Wow, I think that makes a big difference as well. Nothing against the male COs, but there's definitely something that women bring to every table they're seated at, and I think that's important. The other thing that I wanted to touch on, I wanted to kind of piggyback off of what Tammy had spoke to when it came to the racial impact in the U.S. versus what goes on in Norway. And just out of curiosity, I was wondering, what is the racial breakdown in your prisons in Norway? Because here in the States, it is disproportionately Black and brown people who are imprisoned in the United States. Is that the case? I mean, like, how does your population play out?
Well, we have mostly no. We have just a mix. And here in Iceberg prison, I think we have 20 from 20 different countries also. So, but it's a mix. We have, of course, mostly Norwegians, but they are also someone is Black and someone is white. So it's not a really big. We have not. It's not.
So you don't experience the same kind of disproportionality that we do here in the States? Not
the same, but we have when you put so many people with so many backgrounds together, we have difficulties sometimes, but not one big with one particular race. No.
Right. And in closing, I just want to say that I'm really impressed. I mean, I did have knowledge of what goes on in Germany because of, the relationship and partnership with Commissioner Semple when he was the commissioner at DOC. But I think it goes a long way in stating that what you all do around keeping intact the humanity and the dignity of these inmates is critical, is crucial. the point that they will return to society. And I love the question, you know, what do you want your neighbor? Who do you want your neighbor to be? What do you want your neighbor to look like? That's really important. So just a salute to you all, and just a personal thank you to you and the other folks that work there with you. Keep doing the great work. We got all eyes on you because we believe there's a lot that can be done to make our prison system a lot more better and actually conducive to the kind of things that we believe reentry should be. So thank you.
Thank you.
Thank you, Robin. And I know we had one more question from Daryl, and then I think we will look to wrap up.
Hi, thank you. It's kind of like in line with something that Representative Porter said, and you know, we would be remiss not to talk about staff. And one of the things that was the first time that I heard you say today, Ellen, and all the conversations that we had is like there's not enough self-care on the staff end. And one of you know, I have a lot of friends who have actually been reaching out to me from the holistic healing world, right? So they believe in holistic healing, yoga, sound healing, and all of that. One of the questions, they had a twofold question really quickly, was over like mandatory overtime. This is something that we see with our staff in our correction system, mandatory overtime and burnout. Is that something that you see, as well as, you know, is there may be, you know, this may be further conversation for us, but is there, like, you know, because it seems like it's an issue for you in addressing it. So is there mandatory overtime? Do you see a lot of burnout on your end, and how do you address that, the stress levels that individuals are having there?
Not many burnouts, but and we don't have mandatory overtime. Everybody choose if they want to do the overtime. That's their own choice. Yeah, and I have 35 people that I'm in charge of, and that's my responsibility. And I use a lot of time, but I can see when they have a bad day, when they are tired, when they're struggling with something, and then I drag them in. But I'm just a prison officer, so I don't have the education to be a psychiatrist. But we try to talk about it. I take them into the office and let them talk about it, because that helps a little bit.
Okay, I appreciate that. We may talk later offline about some stress reduction activities and friends that I have that may can help with that as well. Okay.
Great,
Thank you so much. Thank you, Ellen.
And I had just one more question from, this is through Robin Porter again, because we haven't touched upon the juvenile system. The Reentry Collaborative focuses primarily on the adult system, but would you give us just a little bit of a sense of the juvenile population? And by that, in Connecticut, we mean under 18.
Yes. We have two facilities in Norway who are mainly only for the ones between 15 and 18. It doesn't look like normal prisons. It's more like houses, but it's cells, locked doors, and the prison officers in uniform. There are they have seen now that that's way too little. So we here in Esbjerg have got this project with 3 beds, and so we are struggling a little bit to get them, because they're in the prison with adults, and that's another thing that we don't really want here in Norway. We don't want to have a 15-year-old in a prison with a 50-year-old. But now it's critical, because they have not enough beds for these kids. So we have made a little group, a team, who are working with them, and we are trying to isolate them from the rest of the adult person, but they have to interact at some point, and it's that's been quite interesting to work with. But we don't have it's not a huge popularity. We don't have that much, but we have per now we have 30 inmates here are under
Wow.
25. And we have 97 prisoners at the time, and 30 of them are under 25, around 20, most of them.
So a much smaller population there, and again,
Yeah.
this is not a conversation that will be able to cover everything today, and you know, we certainly appreciate everyone's time, the time that Ellen has given to us. You know, we talked about normalcy, and I'd just like to point out that, you know, Ellen was not handpicked by the Norwegian justice system to communicate with us. Again, I'd like to mention it was a MSW intern with us, Kelly Ladd from Sacred Heart, who reached out to her through her boyfriend who lives in Norway, and she generously has given her time. My sense is, Ellen, you've probably never had these conversations with folks in the U.S. And so, no, so I mean, you talk about normalcy. This is a normal individual in the Norwegian prison system, and she's essentially what is equivalent of a warden. And they're much smaller facilities. There's a lot more of them, but as I think everyone can see, it's a vastly different system, and we haven't touched on it tremendously. But what that meant in terms of the normalcy of the interactions with COVID, because as we began these conversations, not just with Ellen, but also with the Reentry Collaborative and our series here. And what's primarily on our mind right now is the coronavirus. But in the normal system, as we've experienced these calls with Ellen over the past month, we have seen that the most that they had was 10 inmates, I believe, and 6 guards in Bastoy. And that pretty much is now null, and they're going back to normalization of their daily lives in little bits and drabs. And so, you know, they had the ability to have single cells because they don't have such cramped quarters and so many people put together, but they also were able to react in ways to mitigate that issue. And so we know we're not there in Connecticut. In fact, I just was told that a third inmate has died now in Connecticut, and that was announced today. It's very sad. And actually, the visiting room that we visited in Cybulski there, we saw an article of one of the gentlemen who works for the Office of Early Childhood, who helped to design it. A father of 2, just about to be married, recently died from COVID. We know that a probation officer has. And so this is really hitting home, and I don't think it's lost on any of us that the way we have designed our system has exacerbated that. And, you know, so I do want to thank Ellen for her time. We will continue these conversations. If anybody who's been watching has any questions, we'd love for you to bring you into the conversation. And as I mentioned, you know, we've had some technical difficulties, not much. But there is still nothing that's the same as human interaction, and we would love to exchange a little bit more in person to be able to see and touch and feel and have conversations with other individuals in the system, with folks in the community and the like, to really get a sense of that and how we can bring that potentially back to Connecticut from the ground up, from the community up, because it's not just on the Department of Correction to make these changes. And so we thank you so much for participating today. I do want to announce we are having our film series continue this Friday at 3:30 p.m. where we're going to be showing a film on homelessness and impact in the justice system, and we'll have some featured guests for that as well. And we have decided internally within the collaborative, because this virus is not going away in Connecticut anytime soon, and its impact, that we will continue these conversations into May. We've had good feedback, and we do want to keep this conversation alive. I think we're calling it Moving to Action May. So we'll look at action steps in terms of housing, employment, and the things that we can do to, again, mitigate this crisis and ensure that the least amount of people are harmed by it. And hopefully we do it with as much dignity and normalcy as possible. And thank you for your perspective, Ellen, on that. And we very much appreciate.
Thank you for having me.
All right. Thank you all.